Well, hi guys, we can go ahead and get started. I just wanted to welcome everybody to our, I guess it's not a bonus webinar this year, it's just part of the series, but a little bit different than our traditional medical student webinars that we've been putting on this year. So if you've been to one of these, you may know my face. I'm Ashlee Bolger. I have been tasked with organizing well, Amy really does the work, but I am hosting them today and the rest of the season. So I have the pleasure of introducing four of my colleagues today. We're going to talk a little bit about the Pediatric Rehab Combined programs and answer any questions you might have. So maybe I'll do like a quick introduction for myself, and then I'm just going to call on the next person that's next on my screen. Yeah, I'll do it. So, like I said, I'm Ashlee Bolger. I am the program director in Cincinnati for our combined program. I, like my other two liners, I graduated from that program many years ago at this point, and stayed on and ultimately kind of matriculated up the chain. And then I do a little bit of inpatient and then a combination of neuromuscular and spina bifida is kind of where my clinical stuff has gone. So I'm going to call on Emily.
Hi, everyone. I am the newest to this group of colleagues. So my name's Emily Kivlahan, and I am the program director of the Northwestern Dual Program. So this is a new program. So this is our first year recruiting. We do have a very well-established pediatric residency program and physical medicine rehabilitation program, but this will be the first combined slot. And I did do my residency here as well in PM&R. I also did my intern year at Northwestern. So I did all 4 years there. And then I did not do a dual program. So I went and did my fellowship over in Boston at Spalding Rehab. And then came back a couple of years ago to Chicago as an attending. And I also I do a little bit of everything. I do about 50% of the time I'm on inpatient. And then I also do consults, clinic, and I'm in a lot of specialty clinics about early detection of cerebral palsy in particular.
Awesome. Okay, Eileen, you're next on my screen.
Hey everyone, I'm Eileen Shieh. I am coming to you from Wilmington, Delaware. I'm the PD of the Jefferson Morris program, and I, similar to Ashlee, am a lifer. So I went to medical school at Jefferson, trained through the combined program, and then stuck around as faculty. I'm originally from Buffalo, New York, and clinically, my duties are kind of like everybody else, a mix of inpatient consults, and then on the outpatient side, I see neuromuscular, spina bifida, and then limb difference kids.
And last but certainly not least, Amy.
Hi guys, thanks for joining us. I'm Dr. Amy Kanallakan, and I am at the University of Colorado. So I'm the program director for our combined pediatrics PM&R program at Children's Hospital Colorado / University of Colorado. So I graduated from this program a decade ago and then have been on faculty since then. I think what is really cool about this whole group is like all of our passion is really in medical education. And so that is my academic niche as well. I'm also the program director for our 2-year Pediatric Rehab Medicine Fellowship, which is that 2-year program following a PM&R residency, which is another way to get into our field. So when I'm not mentoring people or teaching in clinic, I generally have sort of a mostly outpatient pediatric rehab practice. And I love those like new patients where you don't know necessarily what's going on, but you guide families through that journey. So originally from Minnesota, that's where I fell in love with pediatric rehab, and then have really made my career and home here in Colorado. Thank you, everyone.
Okay. One sec. Sorry, I have to say a quick good night to my children, but I'm going to get started with our first question while I do that. So in general, the way we're going to do this, I'm going to ask one question to get us started, but then if you have questions, either put them in the chat or you can unmute as we're transitioning between questions. This is really meant to help you all discover a little bit more about the combined programs, and kind of different nuances with that. So really any question is fair game. If we think it's illegal for us to answer it, we will not, but there's very few things I think that the four of us would probably not be comfortable answering. So I'll get us started with just a general question to you all, is why or when do you guys think that students should look at the combined programs? Like when you're counseling medical students, you're having those discussions, like what makes you kind of think through like, hey, I'm going to introduce them to this concept, or I think they should look at this?
We're like, who's going to go first? Eileen, take it away.
Oh, I was going to say, usually I will recommend looking into the combined program if you have explored the field early and know that you are committed to doing pediatric rehab. 5 years is a long time during residency. So if you know for sure that you want to do the field, it's a good thing to consider. I would say another reason I would suggest a combined pathway versus a fellowship pathway is if you know that you potentially want inpatient to be a portion of your practice. Not to say that if you do the fellowship route, you can't do inpatient, but you do get more exposure to PICU, NICU through the combined route than you would going the fellowship track.
Yeah, and I think like seeing yourself as a medical student, what rotations do you enjoy? You know, is the thought of working in the pediatric ED, being in the NICU, being in the PICU, like seeing that acute care kind of early on throughout, if that energizes you and makes you really excited about the next 5 years, then I think combined training is a really great match. You know, both avenues, PM&R followed by a fellowship, you know, then we'll even talk about the permutations of pediatrics followed by PM&R. Like they're all out there, and I think it's about thinking about that. But then also like we'll talk more and sort of put some of our trainees' contact information available out there too, because I think even talking with people who've been in your shoes can be helpful.
Yeah, I obviously did do the fellowship route, and I think I spent a lot of time in the adult, cardiac ICU. That's not super relevant to me now. But, I think that there's, of course, always strengths to all of the pathways. And I think that we have a really diverse specialty, even in the way that people practice. And so I think kind of thinking about what you like the most, that, there's definitely times that I wish I kind of understood a little bit better about, what kids go through in the NICU, and kind of that medical side of things. And I think one thing that I just love is really, really complicated kids. So I think a lot of the big academic programs will have types of like complex care programs, or they're called different things in different places. But I think, if that type of population is really exciting to you, having that, really good foundation in pediatric medicine is helpful. And then of course, definitely inpatient, because I think anybody who's doing inpatient rehab, you're doing a lot more of the medicine management than you maybe are when an outpatient, when you're kind of more staying in your PM&R lane.
Yeah, I don't know that I have a ton additional that's like eye-opening, but I would agree. I think, kind of reflecting back on what makes you happy and, what gives you joy. And, for me, that was, I always saw myself as a pediatrician, and then I found rehab. And so that was sort of my decision tree that sort of naturally happened. But I agree with everybody else, just being able to see yourself in some of those other rotations that you wouldn't necessarily have to do, and really being willing to do them the way it stands throughout residency. I like to tell people that I mentor, like, it's not necessarily the easiest way to get to being a peds physiatrist. Like we still have call months in our 5th year. And, as much as I'd like to take them away, like part of that is purposeful. And so like, I think, just recognizing that there are different pathways, and you're going to be a great pediatric physiatrist no matter what pathway you take. It's, but just slightly different. So I know there's some folks, they're putting emails and whatnot in the chat. Thank you, ladies. Does anybody have any questions? I mean, I have a bucket list in the background, but do any of you guys have questions that you wanted to make sure that we answered or were curious about?
And there's absolutely no dumb question, because
Yeah.
this is a hard puzzle to figure out when you're in your shoes, and depending on the people and mentors you've had, this can be really difficult. So we also want to say that there is no dumb question, and finding the niche of peds rehab sometimes can be tricky enough depending on your institution. Nonetheless, mentorship on the pathways to get to like this type of career.
Yeah.
Gonna jump into maybe a hot topic in peds rehab. My name's Madeline. I'm from Texas Tech. I'm a 4th-year med student. I am kind of in the boat of I see myself as a pediatrician and then kind of fell in love with the rehab and complex kiddos. Outside of doing, or let's say this, how soon do you think you envision seeing a fellowship ever for rehab coming after pediatrics?
Ashlee, I nominate you.
I was gonna punt it to you. So Amy and I have been part of these discussions that are happening actively right now. I don't know what their timeline is. There's been some information gathering over the last 6 months, just not necessarily for that pathway, but just, there is a workforce shortage of pediatric physiatrists. At any given time, there's often 30 to 40 open spots, and we have maybe 15 people graduating a year. And so you have job security, so that's the good news. But in real honesty, like there's a job shortage and we need folks. And so trying to figure out what does that look like? How do we recruit more people? So there's a group looking at that right now. That is one of the things that they are proposing is a pathway off of pediatrics. I would suspect it's still years away. I think just knowing how slow things move at all the different levels it would need to go through before that became a possibility. I think if you're a first year, I don't know, maybe you might see it, but I would say if you're anywhere past first year, I'd be shocked if it was something available in that short of time. I don't know.
I think
currently the path is pediatrics followed by like a PM&R residency with kind of as much peds rehab maybe intermixed during your pediatrics time as possible, and then also like on the PM&R side too. So we're currently training a pediatrician, Dr. Annalise Rasmussen in Colorado, where she did her peds at Davis and then is in PM&R right now. So I think that the desire to make more creative training tracks, is out there, but, things move slowly, but know that this is part of the discussion.
And I think there's also a lot of strong opinions in various ways. And I think, and I hope, and I do think that everyone just wants to figure out how to serve this patient population in an appropriate way and also make it accessible so people want to go into it because it's the best field ever. I do think that there is a strength in some of the adult PM&R too, though. I don't think that is a wasteful thing to experience. I think, I know kids are not small adults, but kids become adults and kids with cervical spinal cord injuries become adults with cervical spinal cord injuries. And so I think really having a sense of what that lifespan looks like, and really diving into all of those comorbidities of all of the different pathologies that you see can be a really great experience.
And I think that with that being said, one of Ashlee's questions, I'm not to steal from your list, Ashlee, but
go for it. That's why I sent it to you guys.
Yeah, if you apply to a combined program, should you be applying to either pediatrics or PM&R? Absolutely. This is where talking with everyone, like, I want to see someone mentored to make sure that they're applying broadly. Because I also know when I review combined program applications that may not even be someone's first choice, or maybe they don't know yet. Maybe they have 4th-year rotations that they're still going through. They're still trying to figure out like what is the best match for how they want to train. And so, with that being said, sometimes people are PM&R, sometimes they're peds. I admit when I applied 15 years ago, I applied to combined programs, peds programs, PM&R programs, and and I would have been happy via many of those tracks. So I think all of us, expect that. I hope to see someone's application in the PM&R side or the peds side, like depending on where they are. And I also understand the conflicted nature of kind of like loving all areas.
Agree with that fully.
Thank you. This was really helpful. I appreciate that. Possibly exciting things in the future, but for now, question marks.
Absolutely. Anybody else have questions, or I can pull off of my list if people don't have anything right away?
I have a question, sort of jumping on the, are we applying just PM&R, peds, all three? How do you recommend, or how much specific peds rehab experience do you want to see coming into the application cycle in terms of audition rotations, electives, research versus, I guess, trying to cast a broader net and doing more adult rehab and also having some peds experience, just sort of like figuring out how to balance those free spaces to be able to see what I want to see, but also have a good background going into it.
What do you guys think, Alta?
I mean, I think some good balance, like enough rotations to really for someone to find their passion. For me, I think I did at University of Minnesota a Gillette rotation, which was peds rehab, and I was like, do I love it or do I love it here? And then I did an away rotation, which I think was helpful. I ended up doing it at Colorado, which I think helped me in that point as an applicant, with sort of just to really see it and work with people and say, aha, this is like a group of people that I want to train from and learn from. And then I knew it was important to, I sort of loved working with children. So I think I even did like NICU to see that exposure and some other, peds subspecialties. But then it was important to do an adult PM&R rotation. I think like if you can, it's helpful to get some type of, whether it's like adult neuro rehab, not everyone has PM&R. So think like sometimes in an institution, it's sort of a neurology neuro rehab type experience, or maybe it's even musculoskeletal or pain, so I think it's helpful, like who looks at your applications? We understand sort of the diversity of rotations that people are looking at. Sometimes it's a pediatrician, sometimes it's a full-on adult PM&R doctor. So I think often in the interview trail, sort of being able to speak to your understanding about what the practice is like in adult PM&R is helpful. It's helpful to understand what potentially 18 plus months of your training could look like, and to know that, to convince those other interviewers out there that like, no, I don't hate adults. I like them too, You guys agree?
Totally agree. Yeah, I would say, when you're looking at who is going to be helping out during rank list and looking at whether or not you'd be a good fit, we have, the peds department as part of that process, as well as the adult PM&R department as part of that process. So from their components, since you're spending so much time with them, they want to make sure that you are committed to learning and are into that learning as well. So I think the trifecta would be doing some type of gen peds rotation, doing some adult rotation, and then peds rehab time. And then if you have bonus time, really kind of diving into peds rehab experiences. But yes.
Yeah, the only thing I'll add to that is, our pediatrics program really appreciates more of an, whether you call them an AI or a sub-I, or like some peds rotation where you have more responsibility, and that will, not that you have to have it. And I think we talked about this last year as a group, is like, there's nothing that you necessarily have to have. I mean, I would argue it's going to be real hard if you don't have a peds rehab rotation for us to like recognize or realize that you want to do peds rehab. But outside of that, like, there's not really requirements, and we get that there's different pathways, and you find us at different points, and schools are more or less flexible whenever you find us. And so like we totally recognize that, but yeah, I would just add like an AI in something peds based, like if it's a hospital medicine, if it's an ICU, you know, something where you're given a little more responsibility. And if you can get a letter of rec from that person, bonus points. The nice part about that, I think if you're not like enmeshed within it yet, you can get more letters of rec than you need, and you can pick and choose which ones go to which individual program. So like if you know you're applying to like, you know, Peds Rehab program at X institution, you may send, you know, A, B, C, and D letters there. But if you're applying to PM&R somewhere else, you may pull out that pediatrician letter because that's not as meaningful, or, you know, however you want to navigate that. But I know a lot of people kind of just finagle and piecemeal things together a little bit depending on the program they're applying to.
Yeah, and I think I would say definitely like a strong inpatient rotation. If you're able to do an inpatient PM&R rotation, I think that's a really good experience. I think doing a bunch of outpatient MSK PM&R rotations is going to give you a very different feel for what to expect in residency than really getting that inpatient side. Yeah, and I think if you can do a sub-I in peds, I think that's a really nice experience to kind of help you get ready as well.
I think I also talked to medical students where sometimes they just can't get that. Like they've asked for it, but based off of how their medical school works, they got MICU, you know, and so that happens, and we get that, you know, and we, you know, have conversations with medical students about that, and advocating for yourself and you know, the best you can at your institution. But sometimes we understand some things aren't in your control. And with that being said, I believe that a personal statement can look different if you're applying to the combined program than even if you're applying to like the University of Colorado PM&R program, because you hopefully will use words like combined training in your personal statement. Why pediatrics, why PM&R, why this pathway, you know, just sort of showing an understanding. And then it's okay to sort of have more of a peds rehab or why physiatry tone in a personal statement for that type of program. So don't feel like you have to have one personal statement. And I really strongly encourage having a little bit of a different flavor if you're applying to even the same institutions like pediatrics program or PM&R program. It might be different if you're like suddenly in your PM&R personal statement, you're saying you want to do interventional pain and there's nothing in there about peds, but you know, be true to yourself and be honest with how, like what you are looking for. But also know that like whatever personal statement you apply to might look different depending on an institution or which specialty or combined program you're applying to.
And that probably brings up a good point that I try to convey to medical students is don't assume that we know that you want the combined program just because you applied. So I will tell you, we get lots of applications that I can find nowhere on their application anything about peds rehab. So you really like pretend we just don't know and spell it out for us, because we're going to probably assume the negative if you don't tell us, because we have, you know, we do have a decent amount to go through, and I think all of us agree, like we don't have that many interview slots because we're a smaller, you know, program, and, you know, that's just how it works. But yeah, don't be afraid to tell us like, hey, I'm interested in your combined program, you know, because everybody's experiences are different and we don't really know unless you tell us. So, but I've definitely seen lots of personal statements that talk all about how they love MSK and they're in my bucket. And there's nothing about peds and I can't figure it out. And so, you know, 99% of the time, those people don't get an interview. And I have no idea if they actually wanted peds or not. I have no clue. So.
Then hopefully they discover it in residency and then apply to fellowship, you know, so. I think that's where like I love meeting people interested in our combined program, because I don't know like what part of training they may choose or what they're desiring, or in what phase of caring for kids with special needs or even PM&R that like we might become future colleagues. So admittedly, a number of my future fellows who've matched and have been absolutely wonderful fellows, like I met on this type of conversation talking about training tracks. I even interviewed some of them for residency. Some chose to do PM&R, some, you know, so and I know that this is where you know, it is a two-way street in terms of you guys figuring out like what is the best match for your career goals, and then figuring that out and meeting people, you know. So I think this is where asking questions before the interview day, like here, or via informational Zoom sessions with me or my trainees or any of us here, you know, I think is a really good time to talk about this, as opposed to like during the interview, like trying to figure out what this field is.
Can I ask a question about the like intern year for like a combined program? Because my understanding is that you know, you could do an intern year in like an internal medicine heavy, like a prelim year, or like surgery. Like, do students do like a pediatric intern year? Because I'm not entirely sure how that works. And then for the combined program, how it looks on your guys' end during like that intern year.
I can certainly take it unless you guys want to explain, but when you match into a combined program, you basically get the intern year included. So it is part of our 5-year program. I will let the others speak to theirs, but ours is essentially a pediatric residency intern year, just like you would be a Cincinnati Children's Peds resident. There's a few minor permutations, like we say you have to be placed on the neurology team, because we feel like that's a pretty important inpatient experience to get as an intern if you're a rehab resident. But other than that, I think there's that. And I think they get one more elective actually when we went to a new schedule. So so benefit, but for the most part, they're entirely pediatrics residents, and it's all embedded. You match all at once. And then for PM&R, there's definitely two versions of programs. So there's what's called advanced, where you need to find an extra intern year. So those programs start your 2nd year, and you have to match separately into what you're kind of the surgical year, the transitional year, you know, medicine year. And then there's also PM&R programs that are categorical that encompass that intern year as well, and you match in all together. And when you're doing like your match lists and all that stuff, you probably are going to have a mix of everything. So I know when I was going through this 10 years ago, 15 years ago, whatever at this point, I had kind of 3 buckets. So I was interviewing at the combined programs. My backup was PM&R. So I had some programs that were categorical, some that were advanced. And then I also, because of that, had to interview for intern years. I happened to make the decision that if I didn't get a combined program spot, I wanted to do a PEDS intern year. There's a handful of them out there. So I limited it to that and told myself if I didn't get one of those, then I would just scramble into a random spot and my life would be fine and I would deal with it for a year. But that was sort of how I navigated it at the time. But you'll probably have a mix of a lot of different things if you decide you want to aim for the combined programs, because you just kind of have to with the nature of everything.
Our program is similar. Intern year is pretty much like you were a general pediatrics intern. Our program has moved to X+Y. And so there are certain tracks, which is the Y, outpatient and advocacy time. So we strategically place our peds rehab residents in the neuro/room track for that purpose. And then they have extra elective time, which is peds rehab.
And because I learned X+Y terminology this year, just for everyone out there, it means that like the PEDS program requirements have kind of changed. And so a lot of our programs are sort of going, instead of like hard month all in a row, X+Y tends, if I were to just simplify it, it's sort of like more intensive inpatient rotation than sort of a less intensive rotation, which usually is like an outpatient rotation, and kind of alternating. So it allows, I think, a little bit better, hopefully less burnout, a little more, less variability between like some schedules being like 2 or 3 hard months in a row, and you know, and then you're trying to work on your sleep deprivation and stuff. So so PEDS programs in general are even moving into this model into 2nd and 3rd year, but some are taking a little longer to get there. So what we are doing as program directors is then interweaving any changes to the PEDS program to requirements, to any changes to the PM&R program requirements, and then also making sure that all of our programs are compliant with our little Tetris of requirements for the combined programs. So this is where, like, between all four of us, like, our whole goal is to sort of make sure that all of our trainees fulfill requirements to be able to be boarded in pediatrics, in PM&R, and in combined, pediatric rehab too. So that's my little X plus Y, my own self-learning and how I'm learning, even how in Colorado we're adjusting things. And I think for the better. I think I'm excited about it.
Thanks for translating, Amy. Yeah, absolutely. And I think our interns and our PGY2s now have felt very positively overall about X plus Y. In general, I feel like most programs are structured either 4 or 5 weeks of those more intense rotations and then 1 or 2 weeks of those outpatient rotations. But embedded in those outpatient rotations, we have some advocacy days and then also some just administrative days. So our residents have really enjoyed having known administrative days where they can schedule appointments and do car maintenance and stuff like that, that typically your rigorous intern year may not allow for as much flexibility.
May I ask a question?
Absolutely.
Hi, my name's Ryan. I wanted to ask sort of more about what highlights and sort of like passion projects you guys have at each of your programs. I know it might be a little more of a longer-winded answer, but things like your residents are doing, things you really like about your hospital system, ways to get involved in your local community. I know you guys are all kind of spread out and probably each have something a little different to offer. So I kind of wanted to see.
I hate being the one to go first every time, but this is like my favorite thing to talk about. And I've had some really amazing seniors the last few years. And so, like, I love to just talk them up because it's all them. So I would say in Cincinnati, I would say a theme over the last maybe 5 years or so has been increasing our options for adaptive sports in the city. So when I went through residency, we literally had nothing. Like, I take that back. We had a wheelchair basketball team and we had sled hockey, and that was pretty much it. And gosh, it was probably 3 or 4 years ago, one of our adult PM&R residents at our affiliated program basically created a nonprofit, and it was all for adaptive sports, and it has just exploded. And so that's been, like, a lot of our residents have taken projects off of that leg and kind of created different things. So my resident who graduated last year, Austin Scott, who's going to start in Indianapolis in a few weeks, he just has a passion for adaptive video gaming and keeping kids involved, like with Duchenne muscular dystrophy, as they may lose function, or just people that don't have function of their hands, and how do they have that social aspect of video games that he's just really passionate about. And so he took everything and ran with it and created an entire adaptive video game program over like his last 3-ish years. He's been working with a charity, secured like tens of $1,000s of donations. He started like a monthly gaming clinic. We've got a whole lab in our hospital now for it. And I just love talking about him. He also won one of the 5 Resident of the Year awards at University of Cincinnati. I'm very proud of him for all of this work. But if people have a passion, we let them run with it. That's a big thing in our program. We're a really small program, so we have a little bit of flexibility to allow people to do that. But yeah, that's probably our biggest lately. And there's a lot of smaller versions, but he just really took it and ran with it.
Let's see, I think like Colorado, I mean, this is where you're going to see the permutations of rotations across our program. Like, we all have to have, X number of months of inpatient, up to 12 months of pediatric rehab, 18 months of PM&R, EMGs, so I think as you look at all 5 programs, there's a lot of similarities. I think in Colorado, what's a little unique for us is some of the, like, we serve our whole 7-state area, and we're like the major children's hospital for a very, very large region of the United States. So I think with that comes like Cincinnati Children's kind of just being in all of our institutions where our children's hospitals are, is just like, this is the bulk of pediatric care. So all of our like subspecialists like channel to peds rehab, like come here. So with that, I think you end up getting to know a lot of your fellows, like people sort of grow up through the system, stay for fellowship. I think Colorado retains a lot of their advanced trainees too. And then I think where this like other changes or sort of additions to our program, like we recruited Steph Tao, Dr. Tao, she did peds rehab. She was one of our fellows. Then she did a sports med fellowship. And now she's like a Paralympic swimming team doc. With our, Colorado Springs proximity to Paralympic headquarters. So I think if people have an interest in sports med or adaptive sports, Colorado is another great place. And then I think the other piece is, I think, development of like medical education there. I know Shirley Ryan Ability Lab has an incredible program through their PM&R residency. And then here in Colorado, we have like most of my trainees, whether combined residents or fellows, kind of take part in an Academy of Medical Educators 3-week collective on medical education teaching curriculum development. So I think has been sort of a common thread of people interest in our program, interest in teaching, and then being developed as an educator too.
Yeah, and then I think kind of putting our med ed nerdy hat on, I love to brag about our residents because I feel like our residency tends to kind of pull people who are inherently interested and passionate about teaching. And so a lot of our residents will just kind of naturally pick up with, talks for some of our more junior residents with didactics, but also help out in the anatomy lab with our medical students. So it's really nice to see them get recognized for all of the hard work that they just kind of naturally put in because they enjoy doing it. I would say probably one of the other unique factors, kind of, similar to all of the other programs that you might see here, is that our graduates have been able to go to different places throughout the nation to start their own careers. But I'm particularly proud of the fact that each person has been able to find their little niche within peds rehab and really kind of own that and develop a program. So we've had people build chronic pain programs or neuromuscular programs or spina bifida programs or NICU follow-up programs. So I think that just speaks to the depth and the breadth of training that when you do finish the program, that you feel comfortable just kind of taking it and running with your passion.
Yeah, I think similarly, our program really tries to help foster everyone's unique passion. Dr. Rowe, who's the program director of the PM&R residency, always has a line that she thinks that everyone's residency really should not be the same because we have such a diverse field. And I think even though, of course, we have certain requirements we have to meet, we really want you to have the type of residency experience you want. And we do have a lot of tracks to support that. Like I'm sure the other programs do as well. And they're kind of larger GME opportunities. A lot of programs will have tracks for medical education or public health or advocacy or global health. That all different types of residents from different residency programs can be a part of. And then we also have a PM&R specific medical education track. We have a PM&R specific leadership track and ethics track. And I don't think we have a global health track yet. But so that's been something that I think has been a big new development over the past 5 to 10 years in our program, is building these not only specific tracks, but actually like rehab physiatry specific. So I think that that's a pretty cool strength. But yeah, I think, of course, because my program is new and we've been doing a lot of marketing, of course, just to make sure everybody knows that it's an option. And our marketing team, the hospitals all have their own marketing teams. And they're like, well, what makes this program like the best? And like, well, it's not the best. I was like, they're all so great. They're all, so I think you can't really go wrong. And I think, of course, we're all going to have a lot of similarities and we're all going to have a lot of differences. And I think if this is something that that you think you're interested in, I think that's why interviewing and meeting more of the faculty and getting to talk to people who are in the program or have been through the program can really help you decide. And then if you decide it's not for you, then you don't rank it. So I think, you're not committing by interviewing, but I think that can really help you glean which one really is going to be the best one for you.
And I think we can all agree that, like, Emily says that they're new, but guys, this is like Shirley Ryan Ability Lab in Northwestern Peds, like in Peds Rehab at Shirley Ryan Ability Lab. Like, I would apply. So I encourage, like, anyone interested in combined programs, don't be afraid that, like, the first time matching, because Emily is an amazing leader and that's an amazing place to train. So you have my endorsement. But apply to all of our programs.
I'd say apparently Amy's going to go back and do another residency is what she just volunteered for.
Well, what I think, like, with that being said too, I think this is where, like, your decisions sometimes are more than just like combined program training. Some people have partners that need to be in this, or family members that are a certain area, a certain region. And so this is where it's okay, like that is an important factor too, like whomever is in your life needs to be happy as well and employed, or sometimes we're caregivers for older individuals in our lives or younger individuals in our lives, and so this is where not everyone can just move anywhere, and we understand that. So I think there was a question, just sort of like, if you're thinking about fellowship or the PM&R track, like you may need to be in a certain region. And so it's okay to pick a training program in another area and then think about fellowship afterwards. So I think if you have the privilege to think broadly, you may consider programs that have a really, like, a good pediatric rehab department. You may ask the PM&R programs, like, how many rotations do they get to do in peds rehab? And so, but also know that I've interviewed basically everyone who applies for my fellowship, and then everyone has different experience and everyone has matched, like, coming out of all PM&R residencies, at least lately. So we'd love to continue to grow that. But if you think, sometimes looking at PM&R residencies that are affiliated with a fellowship could be one place to start, or affiliated with just a really strong peds rehab department with good mentorship. So I think if you're looking at it through that lens, those are some good options. And then the other question that I'll just sort of answer, the best way to signal if you're interested in the combined program is, like, interview, like, talk with us. I encourage you in your PM&R application, don't be like, but I love the combined program more. Like, omit that, have that conversation among peers, we love honesty, but the mentor side of me is like, keep all doors open, for you. And so, if someone's really interested in combined training, like talk with us. It's, like, we understand that there's some people super passionate about a certain track of training. But then also we want to make sure that everyone is having a really good, healthy conversation, that, like, there might be a lot of people really passionate about this track of training. And our awful part is, like, there's only a handful of interns who kind of get to start this track, and so that is a hard sort of reality for us. It's a hard reality, I think, for applicants who sort of are super passionate. And so what I try to do is at least, allow people to know, like, I'm a fan of all the tracks, and it's okay, and I think we can, and I want to kind of keep people tethered to peds rehab, even if they go into PM&R, and try to make sure that it's not just like people think that if they don't match to combine that they're done, so that's my own little thoughts on that.
My spiel is always, in the end, we want to train people that we would be proud to call our colleagues, right? So if you are interested and passionate about this field and are competent and are contributing, we would gladly welcome you to the community, regardless of which track you choose.
And I'll also just add on that, to echo Amy, it's not the end of the world. We know that there's limited spots. And I will tell you flat out, we've had countless number of people that for one reason or another applied to our combined program, either didn't match because they didn't match or just chose to do PM&R. I don't really know in the end, that came back for fellowship. We have one right now and one that graduated last year. And we've had multiple over the last 5 to 10 years. So I always try to make a point of just, telling that to people and like, please don't throw us to the wind, it wasn't that we didn't like you, I promise. Like, it's just really hard sometimes. And it often honestly just depends on the year. I feel like sometimes, and that's really sad and it makes my heart break, but yeah, don't give up. Keep going. Join us, please. So I'll ask a couple questions that I often get when I'm mentoring people. And so this is twofold. How competitive is the program? And if I fail something, do I still have a chance? So how do your programs, how would you answer that?
I think this is a really competitive program. I think the other piece is PM&R over the last decade has gotten even more competitive, and then all of our respective PEDS programs are very competitive, and it's hard. Like it is. I sort of say I'm lucky to match when I did, because I don't think I'd get into my own program. Like I don't, sorry, that's just my own imposter phenomenon speaking there. But it is tricky, So I think that hopefully, like if someone had any academic difficulties, like I think address it. So I think if there's anything in your application that you're worried someone would see in a way that you were uncomfortable with or wondering, like clarify it. Is that the place to put it in, the new ERAS experiences or a difficult time or personal statement? Like I'll defer to you, to the individual on like how to address that. But I think that behind every challenge is growth. And so I think having an honest conversation about that, addressing it, I think is sometimes been my best way to understand an applicant's journey.
Yeah, and I think that you said it perfectly, and that there hopefully was some growth. Obviously, you persevered if you're applying still. So I think helping us understand what did you take from it and how are you better from it and what did you reflect on and change in the future, or just really showing how, how did that failure maybe actually make you better and change your outlook and change your approach to things.
And I would say the one thing I would add that's just slightly different for ours, and I think I said this last year at this webinar, is I'm very transparent. So I don't try to sugarcoat things, and I don't just try to rosy everything up. But our program, our PEDS program, does have a policy that if you fail pretty much anything, I might be able to get away with like a first or second year class and sneak that in. But if it's anything like a clinical rotation, a board score, they just have a policy across all of their pediatric combined programs and pediatrics programs that they will not offer you an interview. So unfortunately, we have had no wiggle room around that. And that's, I guess, the benefit and the curse of working at the #1 children's hospital. So they just are pretty picky. So I try to be open and honest with that, because, all of these things cost money these days. So I hate to see people just, willy-nilly throwing money away if they don't have a chance to get an interview. So.
I agree. Historically, I feel like the pediatric side of it is the more competitive side. Although looking at PM&R applicants the past few years also gives me imposter syndrome. So I think they're both pretty competitive, but I feel like the pediatric side tends to be the one that's a little bit more competitive, and making sure that you're, obviously everybody has to agree to put you high on their rank list.
I think the other thing we're trying to tease out, and I don't know that I have a perfect way to do this or anybody does, but you know, you're signing up to do 2 residencies melded into one in less time. And so like it is busy and it is challenging. And so part of what we're doing with your academic record is making sure that you can handle that. Like, we don't want you to be unhappy here. We don't want you to, you know, be stressed or, you know, stress more than you need to be. And so I think, you know, some of that is probably well-founded, and that if you really struggled through medical school, then probably a different route is probably going to be a little bit better for you. Not to say you still won't be a great pediatric physiatrist, because you will, but this can be a really challenging program set up for people that have had some struggles academically, is what we've found. I think that's also part of the reason why, you know, our pediatrics has that policy.
Yeah, it kind of like across our programs, it's like your second and your third years are almost like your sort of PGY2 stretched out. You know, so when I talk to learners, I think a common thread is like, how are you judging yourself compared to your peers? And so in true pediatric sense, I say, well, your corrected gestational age of learning is a PGY 1 minus where you are, you know, so sort of just like, I see it year after year, and felt it myself, even as I went through my own 5-year program, that like you arrive at the end sort of prepared for the same jobs as any fellow, but the journey there is a little bit like you sometimes you feel behind your peers when you just think of yourself as a PGY4 or PGY5, but I think the right person is sort of comfortable with that discomfort, but also knowing that like this is this unique path that you want to do, you know, that you want to get through. So I think being a gentle to yourself is an important characteristic too, that I think everyone has to learn.
We've got 8 minutes left. Does anyone have any other questions?
Someone asked about like typical board score ranges. I mean, I think that all the programs sort of look to see, hey, were there any failures? Like that kind of sometimes being a red flag or a concern, or wanting to address that. And then, you know, I don't have specific board score ranges, but I know like our peds and peds rehab, sorry, our PM&R and our peds rehab do sort of like, at least on one piece of their, you know, rubric or review is sort of reflecting on some people with some stronger board scores. But I think in general, with pass fail of step 1 and some of this less reliance on sort of board scores being the biggest metric of the past.
Yeah, I would say if you're in like the low, and I don't know what the quartile like cutoffs these days are, but I would say if you're probably in like the lower quartile of board scores, that might be a little bit challenging. But I feel like if you can get out of that lower quartile, then I think it's equal playing field, because we're looking at so much else on your application across the board. But I think it goes back to, you know, not that tests are everything, and we know that tests don't predict success, but I do think it's one factor of, again, this is a challenging residency, and you're going to be sitting for potentially 3 sets of boards in a very short period of time at the end. And so trying to set you up for success with that is sort of one of the things I'm looking at. But our board scores are all over the place outside of, you know, those kind of lower, barely passing scores. But I also think that I didn't even know some of these board scores existed until the last 2 years, just similar to what Amy said. So every year I get a new one and I'm like, I didn't even know they went that high. That's great. So
I think someone asked about fall rotations. So, you know, we know that you're putting your application together in September. You only have so much flexibility once things are submitted. That I think if you're entering sort of a fall or any time between fall and like when rank lists like solidify, like share letters of rec from like a later rotation with any of our programs. You know, it's fine to email that. You know, it may not end up being your heiress, but I think don't discount rotations that you do between October and February, because that could be really career shaping for each of you. So I think as far as preparation is like, so you could speak to that. So I think one of my interview questions, sorry to like blow the surprise, is like, what have you done since this application came through? Share with me, like, what's not in here. Tell me about what's been going on, sort of since this snapshot of your story. So I think that don't discount it. It's okay to be doing rotations. And then also, let's say you were in Colorado, it was the middle of interview season and you're interviewing and you're on rotation. I get it. Like, you have to be doing interviews. So I think this too is just be honest. If you're doing, rotations, that interviewing for residency is important. And so anyone supporting your future should really not ever make you feel bad about taking interviews. So.
As far as advice prior to rotating in peds rehab, I always suggest putting together a list of 3 or 4 goals for yourself that you'd like to meet while you're on rotation. That way you're really making use of your time and being intentional.
And I think also if you're entering, a rotation, away rotation, as rotation holders at our institution, whatever we call ourselves, like, we expect to be writing letters of recommendation for people so ask. I know that that's not always comfortable, but if you're starting off, you're working with Dr. Bolger on inpatient, say, I'm interested in peds rehab. I'm going to be looking for a letter of rec. I'd love it from you or whomever I work with. What would be the best way to help with that? So you don't feel like you have to sit on that for a month. Like, we know that this is important.
Yeah. And I'll just add, coming from my medical, because I also coordinate all the medical students that come through our PM&R folks. I wear a lot of random hats here. But, if you need to take time out for interviews, 100% totally get it. And we are going to help you do that. But please don't wait until the last minute to tell us that, because, a lot of us do have requirements that we have to abide by for our schools. And so, and sometimes that takes some creativity with how we finagle your schedule. And so the more heads up that we can have, it just makes me much happier, I will just say. Like, I definitely had some students that, like, the day before, I get an email that's like, hey, and it didn't, it's one of those things that it didn't sound like it was a last minute somebody canceled and now I gained a spot. So just give us as much heads up as you can. We appreciate it.
Yeah, and I think just act like you're really part of the team. And if you were the intern, you couldn't do that. Obviously, if you do get a last minute interview at your dream program or something, but on a regular basis, I think, really try to become an important member of the team. I think if you're on a rotation where they don't really give you clear expectations or tell you that they want you to write progress notes or follow patients, that's a great opportunity to just do it and stand out. So I think just really dive in and try to act like a sub-I on that peds rehab rotation.
Building off the discussion about interviews and scheduling, could you give us a rough idea of the range of interview dates that you all have?
We typically start very late October sometimes. If we have our act together, and we're done by Christmas. For this upcoming season, we're doing 2 dates with a handful of people per date. So we have some peds rehab specific dates. We did it last year for the first time and it worked out real well. So we're keeping with that.
And even Emily too, like, one thing I think we all did last year, and guys, correct me if I'm wrong, but we shared our interview dates among each other to make sure we weren't using the same ones. Because like Colorado, we have 2. And then what I've had our coordinator do as soon as applications drop is email everyone, we've received your application and these are going to be the combined dates. Like, Dr. Kanallakan's going to be reviewing applications, and so I do try to extend interviews as soon as I possibly can. But I know that was something that applicants really felt like that helped them, because if they were really interested, they kind of held those couple dates. And then I tried to not wait a whole month to interview, extend interview offers. I, have tried to do it relatively quickly, just so people can kind of free up their schedule. So that was something that I think has been helpful. And we try to talk amongst ourselves, so we're not like competing with each other's combined interview dates.
Because that doesn't help us either. Because there's obviously a finite pool of you all that are interested in this way of training. So, and I stole Amy's idea last year and sent out interview dates too. So,
yeah. Yep, same. We're doing November, December. We're going to do 3 dates. It'll be a day and a half of interviews.
Yeah, our dates are tentatively also late October, and we'll be done by the holidays too. So I think we're trying to do hopefully about 5, but we're still finalizing the exact dates.
And then 2, like, just remember, like, if you're interested in the PM&R program at Colorado, apply to the PM&R program at Colorado. Your combined program application is only for the combined program. So if you're interested in a pediatrics at Colorado, apply to pediatrics. If you're interested in PM&R at Colorado, apply to Colorado. That. So just because it's combined doesn't mean that checkbox. Essentially, you have to check both PM&R and combined program if you're going to try to rank those residencies, and that's true for all of us. I know sometimes it can be confusing.
And one more thing about interview scheduling, are you expecting your interviews to be virtual this year or in person, or what's the plan?
Virtual.
Yep, I think everybody's virtual.
Some of the programs also offer some different types of second looks, like virtual second looks. I know we have some second looks sort of focused on underrepresented in medicine candidates. So that's usually an open, like if you identify as that population, so University of Colorado does some of that. And then some of the like in-person visits, I think generally on the residency side have been a little bit more like institutionally driven, and sort of best practice in like residency is to not have it be like rank affecting. And then also it's not necessarily, if that visit is allowed, it's not like I'm leading it, it's like, it's really just for the candidate to learn a little more about the institution, but then also not have it be a bias piece when it comes to someone feeling like they have to do it or that it affects rank.
Yeah, so we have a lot of the same kind of walls that we put up. So yeah, so we typically are trying to get our rank list finalized prior to allowing people to come. And then we actually don't have them meet with any faculty. So it's all, we go through we have a chief resident. So we go through our chief resident and they kind of arrange everything. And depending on, what that individual who's coming to visit wants to do or wants to see, they kind of take care of all of that. So hopefully with those 2 things, I never know that it even happened. And thus I cannot even be tempted to bias my thought process.
Hi, I have possibly a quick question. Is there any future growth to the individual programs? I know Thomas Jefferson has 2 spots right now, and everyone else kind of has 1. Is there any growth there?
Colorado will continue to have 1. If we, for some reason, don't match our 1, our spot goes to pediatrics. So that at this point will be where we are. We did grow our fellowship from 1 per year to 2 per year a few years ago. And so our cohort of peds rehab learners at our institution, I think, has expanded, but the combined program has continued to be one match per year. And we're all recruiting for this next cycle.
No immediate plans. I'll give you a really wish-washy answer, but we will definitely recruit 1 per year. If we don't match, then we do have the option. Our spot does not go back to peds, so we can sometimes, the following year recruit 2, which is why you'll see our current numbers the way they are. We actually have 6 right now because we have some residual people from an unmatched year prior to that. But I would say, we have looked expanding, and I would just say that no immediate plans, and my goal is always to balance numbers with the education you're getting. I don't want to expand numbers at the expense of providing a great educational experience. So if that opportunity allows for growth, I think we'd be open for it, but we've we've got some things we have to, figure out, and, things that are some, just barriers. So. Okay, it's a few minutes after 9, or earlier if you're Amy, or Emily, I guess. Emily, I forgot you're in the Central Time Zone. We usually just give Amy a hard time. But thank you guys so much for coming. You have all of our email addresses at the beginning of the chat box. And so don't hesitate to use them. Reach out if you have more specific, nuanced questions. I think, we're all very happy to answer those questions. And to connect with you guys, because like we've said, I think multiple times before, we just, in the end, we just want to recruit good people to the field. And while we all obviously love the combined programs, there's great ways to get to it in other methods. So, so with that, I will say thank you to the panelists for agreeing to do this again this year. So hopefully this was helpful, and I'll sign us off. Oh, and thank you, Amy from AAP, for helping all the time for this and listening to these discussions every time. Hopefully your baseball team is winning.
Yeah. Thank you, candidates, too, for being on late, depending on what time zone you're in. We just appreciate your interest in Peds Rehab, and hopefully we'll continue to cross paths, whether it's our combined programs, fellowship, or even a future career in some other area.
Yeah.
Thanks,
Bye, guys. Take care.